Christy Wergain, we're going to do a longer introduction for you later, but do you want to do the short version right now?
Sure. I'm Christy Wergain. I'm also program manager at Stratus Health, and I am located in Western Massachusetts right now. So what works for me to get people on board? I think the biggest thing to think about is if there's some kind of an urgency of whatever you're trying to get people engaged in, that it's important to them. And it's not meeting like necessarily your needs, but also the needs of, whoever you're trying to get involved. And if they could see that it's going to help them out and maybe lower their workload or that seems to work the best for me.
Thanks, Christy.
Mm-hmm.
Okay, how about the other Christy? Christy.
My name is Christy Inger. I am the lead RN care coordinator for Health Partners Olivia Hospital and Clinic. One approach that has worked for me, I would agree with you, Kim, that definitely kind of applying to people's passions or what really moves them is helpful. But I also feel like reminding them of their strengths and what they can bring to the table to help with a project has definitely worked well, where they kind of feel like they have something to contribute and then they're a little more likely to help.
Great. Thanks, Christy. Greg?
Good morning, everybody. My name is Greg Ruberg, CEO at Lakeview Hospital in Two Harbors, just half hour north of Duluth. One approach that works for me, I think there's really two, is being open and honest, but also sharing the why. So as we've looked at different partnerships in our community, is being honest about kind of the pros and cons, but also sharing why we think the partnership could work, and then just having that honest conversation about whether it's difficult or not, but that seems to be successful. Thank you.
Great, thanks, Greg. And is Rachel with you?
Yep, you can see my silhouette here. This is Rachel from Lakeview also. I work with employee wellness and community coordination for Lakeview. And in answer to the question, I don't have many unique ideas to add to what's already been said, but I agree with Christy that if you can phrase it in a way that it won't sound like a lot more work, but maybe help somebody, that's always helpful.
Great, thank you. And who do we have from Swift County Benson?
Hi, can you guys hear me?
Here you are, yeah.
Sure, so this is Holly Olson, and I'm one of the registered nurses here at the clinic working on mostly the annual wellness visit, etc. We're in Benson, Minnesota here. I would say one of the biggest things to get people on board is just plain being excited about it. And being encouraging and getting people excited about it. I mean, you can really sell anything, as silly as it seems, just as long as you're passionate about it and ready to go and get them on board with you.
Great. Thanks, Holly. Do we have any? I don't think I see anybody else on, but did I miss anyone? Okay. And Holly, we wanted to also acknowledge Swift County Benson was in the top 20 of critical access hospitals in the country for, it was the quality, patient safety and quality. I meant to go back and look up the specific category, but do you want to say more about it? Do you know?
Yes, we did have an email come out about it. So yes, we were very excited about it and very kind of shocked actually about, because we're not doing anything out of the ordinary. We're just doing our regular stuff. And it's nice to be noticed that what we're doing is making a difference. Mm-hmm.
Yeah, it's really exciting.
Yes.
So congratulations to you guys.
Thank you.
Did you all do anything to celebrate?
We did not right at this point. It was just hospital week, so they kind of celebrated that way and everything like that. Mm-hmm.
Great. Okay. So before we move into the content for today, I just wanted to check in, kind of see how things are going, whether it's related to the structuring teams work that we did last time, or any of the things that you've been practicing in previous sessions. how's it going? Like which of the tools have you found most useful? What's working for you? What do you still have questions about?
I'd say for me, this is Holly and Benson. The biggest things that I've found is helpful is setting up those one-on-one meetings. And they're just really productive. And I feel like we get somewhere when we actually sit and talk one-on-one. And the most beneficial thing is not doing that on the fly, is actually setting up a time to sit down and talk. And then we're both invested in it and we both have the time, because we've all had those conversations where either you don't have time or the other person doesn't have time and we just rush through it. And I feel like not as much gets done as when we both dedicate the time to talk about it.
Thanks, Holly.
Mm-hmm.
Has anyone tried out any of these tools with an existing group? Like a team that you have, or a coalition, or a work group that's already established? Because we've been talking about these in the context of, building coalitions specifically for the purpose of improving population health in your communities. But certainly you can use all of these tools with existing teams that you're working with, even internally. I mean, we use these tools with, our internal work groups, as well as with, coalitions that we have with external partners. Because a lot of these tools can be really helpful. Even if you're already established, you can kind of pick and choose, kind of depending on how your team is functioning at a given time. And, maybe what challenges you're facing, or if folks are getting kind of stagnant, things aren't, maybe you're not making as much progress. You can kind of look back and use some of these tools to figure out, okay, do we have the right mix of people on this team still? Do we need a different set of skill sets maybe than we had at the very beginning when we got started? Do people all have the same understanding of kind of what we're doing and where we're headed? There's, so all of those, I mean, that's to me, the really great thing about a lot of these tools is, yes, they can help you build a new coalition and get it started on the right foot with everybody on the same page, but you can also kind of pick and choose which ones are appropriate for wherever your group is at in their progress of whatever work you're doing. It can kind of give you a refresh. Any other thoughts about how you're using the tools, or ways that you're thinking about using them?
Hi, this is Rachel from Lakeview. I can make just a couple comments from what I've learned over the last month. With our shared purpose, I've been looking into joining other currently functioning coalitions and committees, and I've learned some things that when we get ours rolling, what not to do, so to speak. So, like, for example, you mentioned something about the size of the group 5 to 7, and definitely the larger size starts to feel more like it's a report out. So you're spending an hour and a half of your limited time, and that the style is more of a report out, but then what's being done in between report outs? I mean, is that a productive functioning setup? So that's one thing that is just an observation that I've made. And then also being respectful of time and making sure everybody has their role, and some things that I want to keep at the front when we go forward.
Thanks.
And then lastly, just when you get off topic, how do you steer back to the main idea of what you're all there for? So think some of those tools will be helpful that I've been reading about in the participant guide.
Great. Thank you. Yeah, I was at a meeting of our neighborhood association last week, the week before maybe. And it was total chaos. Like it just, I'm not, the board is kind of rebuilding. And so they have a lot of new people, and I think they're still just trying to kind of get their feet on the ground. But there were a lot of things they could have done differently in that meeting. There were about 50 members of the community that were there in the audience, and just sort of watching the lack of coordination. It was clear that everybody on the board even was not on the same page. So I think that it's a good point, Rachel, that you can learn a lot from your experience with other groups, and also just recognize where there are opportunities to do things differently. And hopefully sometimes you can feel comfortable stepping in to say, I have a tool that maybe could help with that. Like maybe we could use this in the future to make these meetings a little more productive. And I think to point to specifically to one of the things you mentioned, Rachel, in the video that we send out for the next session, one of the things that we talk about is, that when you're bringing people on board to a collaborative project or activity, that it's really important to be respectful of their time by giving them meaningful things to do. So while updates are important, there are a lot of different ways you can do general updates. You can send those out by email. You can just make them really quick. Just say, highlight a couple key things. But what's really going to keep people engaged is actually doing meaningful work and being able to see progress over time. And so tracking on that and checking in with people to make sure that's happening is really key. Okay, well, thank you for sharing that. That was great to hear, and hopefully that learning continues. And again, if you, if as you're thinking about using these tools or just wondering what's the best way to use them, feel free to reach out to me or Carrie. If you want to just, kind of touch base about what you're thinking, make sure it makes sense, or want ideas about how to do things, we're always happy to brainstorm with you. Okay, so we have Christy here today to talk about our topic for this session. Christy's a program manager at Stratus Health. She also currently is one of our team leads for the infection prevention and control work as part of Superior Health Quality Alliance, which is the quality improvement organization for Michigan, Minnesota, and Wisconsin. She also does a lot of work with long-term care facilities and nursing homes, and she's been doing that for a long time. She also is currently working with a team on an ECHO project that's aimed at increasing access to treatment of opioid use disorder in Minnesota. So I don't know if all of you are familiar with ECHO, but it's a tool it's an approach that we've been using more and more. It comes out of the University of New Mexico. And then Christy has also completed the official training in the leadership and organizing in action model that we've been rolling out to you over the last few months. And so we're super excited to have her here today to talk about strategizing collectively. So Christy, I'll turn it over to you.
Thanks, Kim. Okay, so what we're going to talk about today is collective decision making. And hopefully after our time today, you're going to understand why collective strategizing and decision making matters and why it's important. We're going to talk about the fundamentals of strategizing, and also we're going to learn how to lead a collective decision-making process. So as a review and to get us all grounded before we start talking about collective decision-making, I just want to review a little bit how organizing is about equipping people with the power to make change. And I know you've seen this before, but I just want to review that it takes up these 3 core questions that start with people. And I know you've spent some time talking about who are your people. So really the first question an organizer should be asking is not just what's the problem, but who are our people? Organizing really starts with people because it focuses on developing and applying leadership skills of those with the problem so they can mobilize their own resources to solve that problem and sustain the solution. So it's, I know you've heard the word constituency. So it's that constituency is the group of people who you're going to stand together with to assert your goals. So once you have your people, which is so important, and you have to spend a lot of time figuring out who that is going to be, or what that group is going to be, then it's the people that gives you power to make change. And the power are really the resources that you have to achieve whatever vision it is that you've decided that you have. And you have to think about what resources do you need. And it is the capacity created by combining the resources and using them creatively to achieve a shared goal. Organizing isn't simply a commitment to identify and to develop leaders, but it's to engage those leaders in building power with one another to create the change that the group is envisioned together. It's not a thing, it's not a quality, it's not a trait, but power is the influence created by the relationship between common interests among your constituency and the resources that your people bring to the table. That's why it's so important that you pick the right people that have the resources that you need to really, really effectively make whatever change you're looking for. When our interest in another stakeholder's resources and their interest in our resources results in mutual interest to join together to achieve a common purpose, this is called collective power, or this is power with. So it's very powerful when you have all the different resources from your constituency that you can bring together. So once you have people and you have your resources, that's when you can really make change. And you need to think about how you're going to mobilize and deploy those resources to achieve your vision. And that's where these tactics are going to come into play that we're going to talk about in a minute. Also has to start with really having big, audacious, and measurable goals. So in organizing, change is specific, concrete, and significant. It does require focusing on a clear, measurable outcome, and identifying selecting strategic outcomes is an art. It's not easy to do. And it focused calls to action that create a real, tangible change. Must have a single motivating objective and you must focus all your resources strategically on achieving it. So your goal must be clear. Everybody has to understand what it is, so you're really trying to achieve it together. Goal setting in coalitions is more complex as it involves aligning the measurable actions of multiple stakeholders over time to add up to the collective achievement of the coalition's larger and broader vision for change. So when you think of goal setting, every organization or your constituency might have different ideas of what's important to them. So what we're going to talk about today is really how do you collectively together find a common purpose. So you're all on the same page, not just trying to affect, your own organization, but whatever your vision is that you're trying to reach that together. Okay, you can, next slide.
And maybe, Christy, just one thing that I'll just say, and we've talked about this a few times, but I think in particular with the resource piece, it's especially both challenging and important in small communities to understand you guys all know, you have limited resources at your disposal. So both in terms of people and the expertise that they bring to the table, and also, the dollars or the materials or, whatever other kinds of resources you need for an effort. So really figuring out kind of who to bring to the table and then how to leverage the limited set of resources that are available to make that change is key. And it's just worth spending time on.
Absolutely. So this slide just shows what are the key questions in strategizing. It starts with setting a measurable aim. So when developing a strategic aim, coalition leaders should first conduct a community-based root cause analysis to ask why the change the coalition seeks hasn't happened already. So if there's something that you feel passionate enough that you brought a group together to work on, it's probably because it's a significant problem in your community. So there must be a reason. You're probably not the first people that are trying to solve the problem. Maybe you are, but it's a good chance you're not. So if the need is so urgent, you really have to think about why hasn't it already been addressed? And if it has been previously attempted, why didn't it work? Why did it fail? So we often jump to conclusions right away before we dig into the problem. We decide, we kind of have an idea in our mind sometimes that maybe we're working on, I don't know, falls or something in your community. You kind of have an idea what you want to do going into it. Not a good idea. You have to spend a lot of time really figuring out, well, what's happened before? Make sure you're not repeating what another group maybe has already done or is currently doing. Find where there's gaps. What hasn't been tried, or what has been tried and why didn't it work? You really have to look at that. You also have to think about who holds the resources to meet whatever aim you're doing and why haven't they acted? And if they are active, why weren't they effective? What is it that got in the way? What barriers were there? And where could attention be focused to prevent the issue from happening to begin with? That's really something to think hard about when you're working on solving some kind of a problem. Really dig deep. Well, why do we even have that problem? And maybe that was where you could put one of your tactics. So in other words, the choice of strategic aim depends on an analysis about why things are the way they are. If you want to fix something, you have to really know what the problem is to begin with and spend quite a bit of time on that. Inspired by the motivating vision and root cause analysis, then leadership teams then decide on a strategic objective on which to focus energy. And this is your clear and measurable aim. Making this choice is the most important strategic decision. An effective aim should have the following qualities. First, it should be a single strategic aim. Coalitions that create real, tangible change have the discipline to choose a single aim and focus all resources strategically on achieving it, remembering that after initial aim is achieved, a new aim can be created. So you don't want to work on a whole bunch of things at once. Then you tend to, it waters down what you really want to achieve. So start really thinking about a single aim. And if that turns out that you can solve that, along the way, you might find that there are other things that also you want to address. The aim should also be clear. It should be fully and succinctly state what will be accomplished by whom, by what date. It creates urgency to act, and it allows people to begin to act now. There's nothing worse than, I know that I've been in a lot of meetings, there are a lot of groups that there's all kinds of things that people suggest you want to do, but then nobody really wants to take the lead and do it. So it has to be clear who's going to do what and by when. And I'm sure that's something you all have heard over and over again. Super important. Your aim should be measurable, so the coalition can demonstrate and describe its impact through data. So you have to really think of what data do we have? What is it that we're going to be able to show that proves that what we're doing is effective? And you need to spell that out in the beginning so everybody's clear on that. Should also have a motivational force. So, and somebody talked about this earlier, one of the things that they get people on board, they try to get them excited. They try to, be infectious. So the aim connects with the heart and motivates people to act. And this is where I'm sure you talked about story of self in the beginning. When you're able to bring that, the reason why it's so important, if it's something personal, if you could bring that to the table, it helps you develop your aim. It also helps get people more engaged. Should also have a leverage point, which means the aim should focus on a place within a complex system where a small shift can produce big changes. So if you could find the one little thing that's going to make a difference, that is really, really important and gets you all kind of on board. Also, think about momentum building, which means the aim should allow the coalition to pursue short-term wins within a longer-term sustained effort. If you're able to, you have your big audacious aim that you want to hit, but along the way, if you have little milestones that you're going to hit along the way, it's really makes your team more excited. And if you could actually reach some of those, you don't have to wait till the very end. You can also change those milestones along the way if things just don't seem to be working and you have to reshift. Or if you get if you're in the middle of a pandemic, for example, or something, you might need to change things. And it should be contagious. So the aim allows for tactics that others can emulate as the effort is scaled up and spread across a constituency or geographic area. So, you probably want to start kind of small, like, let's try this out in this one clinic or this one part of your hospital or whatever. We'll try that out first and see how it works and then spread it. So that's what we mean by it's contagious. So the next bullet you see here is developing tactics to turn resources into power. So picking so once you have your aim and then picking whatever tactics you're going to do or your strategies to get to that aim, that's tough. And that's another thing you really have to think hard about. Tactics are the specific activities through which strategy is implemented. In developing tactics, you should ask, how can we collectively leverage the power of our constituency's resources to achieve our measurable aim? So again, if you're clear on what each of your constituents has brought to the table, what their resources are, then it's easier for you to identify where each group or each member can participate and contribute. After identifying the resources the coalition currently holds, coalition leaders then can identify the resources still needed and brainstorm ways to use the resources, how to generate the resources needed. So it's going to become clear probably that you don't have everything you need and you might have to reach out to other groups. And always think about when you're developing tactics that diversity in perspective and experiences maximizes creativity. So you don't want to have all the same people from the same kind of organizations in your constituency. If you have more diverse experiences and perspectives, you're going to get a lot more creative ideas. You should also allow time for genuine brainstorming. So you have open, creative, no idea too crazy, and deliberation before decisions are made. So think of things that haven't been tried before, go out on a limb, think of some things that are new. So once you have a range of possible tactics and you've developed those and listed them out, the leadership team should decide which to pursue. And when you're trying to decide what to pursue, and we'll get into this a little bit more in a couple of slides, think of these key criteria. Is it consistent with your values? So whatever the tactics you're looking for, does it go with the values of the organizations that are represented? That's very important. Is it going to impact the measurable aim? I mean, is what you're going to do actually going to help move you closer to what you're looking for? Is it also going to develop leadership and your coalition's capacity? Does it use the existing resources that you have identified in your group creatively? Is it motivational? Is it fun? Is it simple? We heard a lot of that fun, when we were talking earlier. And that's important to keep people engaged. Does it build on strengths, and does it engage weak ties and broaden your constituency? Because you might have to broaden. When you find you have some gaps in your resources, you're probably going to have to look for others to join your more constituents. Okay, so then the last bullet here is, what is our timeline? So this is really the implementation of tactics over time. Tactics are targeted and carried out at specific times to focus limited resources on what is likely to yield the greatest results. So you can't come out of the gate and think you're going to do everything at once, right? You just don't have the capacity to do that, and it's really probably not effective. So it's important to see the span. So that's the time over which we are strategizing, and the scale, which is the ultimate level of impact you hope to achieve. So you might have heard the word campaign. Or maybe you've been involved in a campaign. Well, a campaign is a way to structure time, and it unfolds over time with a rhythm that slowly builds the foundation and gathers gradual momentum with preliminary peaks, reaches a pinnacle when the aim is achieved, and then resolves. So, there's peaks and peaks and peaks and peaks until you finally reach your aim. So the organizing framework asks, what are the dates and benchmarks? How will implementation of tactics be timed to add up to the measurable aim? And how will efforts be constructed to build capacity and develop new leaders over time? In organizing, coalitions often begin with fewer resources than they need to achieve an aim. So that's why you might start kind of small and then have to build. Increasing capacity, which means capacity of people, money, and skills, is critical for enough volunteers to create a critical mass to move forward. And this activity builds momentum. It's kind of like a snowball that enlarges, and each success contributes to resources and capacity, which makes the next step more achievable. Leaders identify milestones for when enough resources and capacity have been gained and enough power has been accumulated to undertake activities that could not be carried out before. So reaching a new threshold gives that gives new capacity. That's what's called a peak. And a peak is not simply a milestone on a strategic plan. It's a peak because it's a threshold that's crossed as a result of mobilizing the many resources to achieve it. So, we talked before how, it's good to have little goals on the way to your final aim. So each time you reach one of those goals, that would be like a peak. An organizing strategy is built around a series of peaks that culminates in a final peak when the aim has been achieved. Each peak should have a measurable goal that launches the coalition forward towards the next peak. So you're always moving forward. You're keeping people engaged and excited about the work because you're actually, achieving something. Okay, so any questions? I know that was a lot of information. So I don't know, Kim, did you want to add anything? Or Carrie?
I think we're going to talk about this more as we go forward, but I think that decision-making part about tactics is understanding the problem is really important. So you've probably all been part of groups where everybody just jumps to a solution. We're here to talk about how to improve management of diabetes. So let's try this and let's try this. And, you just pick something, whether it's because it's something that somebody's done before or, maybe a model that somebody knows about. But if you're not actually if you don't take time to really understand the problem first, then there's no way to know if the solution that you pick is really going to address it. So it is important to go through that process. And then I think the other thing that I think can be challenging as you're thinking about tactics is how do you get that right balance between evidence-based practice. So we all talk a lot about making sure that there's evidence to support the work that you're doing, and trying innovative things. So, testing out new approaches. And I think a lot of times, probably where we need to land is somewhere in the middle. Because the fact is that if you look at evidence-based practices, you have to consider the context in which they were implemented or tested initially. So the evidence base, the practice might work really well in an urban community where, you have a certain set of resources available, or you're working with a really specific population in that community. But if you try and implement it in a rural area, you wouldn't have the same result. So in the same way that it's important to understand the problem as you set the aim, it's also important to understand the evidence behind the strategies that you're exploring.
Yeah, and Carrie just wrote in chat, like public transportation. That's a great example.
Yeah.
Really good example. Okay, so I'm just gonna review the organizing sentence. I know that you've talked about this before. And so you talked about having a shared purpose, and the organizing sentence is a way to state the strategy in a really nice, concise way. So as we think about collective decision-making and strategizing, in the organizing sentence, we're focusing on the to-do, which is what you've identified as your measurable aim, and the buy. So the buy is like, what are the tactics you're going to use to reach that aim? So as you remember, we are organizing to do what, by, which is the how, in order to, which is the why, and the by is the timeline. So I'm going to give you an example of an organizing sentence that I recently wrote. The timing of this is really good because I'm just starting a new project, the ECHO project that was opioid project that Kim talked a little bit about in the beginning. So I was thinking about, okay, this is really a good time for me to think about how can I put the work simply into an organizing sentence so we can all understand what we're going for. So here's the example. So we're organizing Minnesota office-based opioid treatment clinicians and clinics in underserved rural and urban communities and American Indian populations to increase access to locally available opioid medication-assisted treatment by participating in a series of opioid project echoes. So that's going to be our tactic. We're going to have like 3 different project echoes to build their capacity to deliver high quality care in their own communities. In order, and this is our vision, which is in order to reduce overprescribing of prescription opioids, treat addiction, and save lives. And we have to have this done by the end of October of next year. So that's our organizing sentence. That kind of gets us all on the same page. We know what it is we're trying to do. We know our basic tactics. There's obviously going to be some different goals along the way. We have to think about how we're going to measure that. But this has been putting this together, if you haven't done already, is just a really, really good way of helping you just really, in a simple way, understand what work you're doing. Because sometimes you go into I know I've been in a lot of teams or projects when you're not really clear exactly what it is you're trying to accomplish, and it keeps changing, so this is very helpful. Okay, next slide, please. Okay, so there are these 6 different stages to collective decision making, and most of us are, you're familiar with half of these stages. You've already talked about this. That would be identifying the aim. We just talked about that a lot. Generating ideas, and then deciding what you're going to do. But steps 2, 4, and 6 may be the key pieces we've been missing to ensure the choices and decisions we are making are effective. So we're going to really focus on those for a few minutes. And the first one is number 2, which is identifying selection criteria. And this is identifying selection criteria to tactics that you're going to be choosing. So criteria are how teams decide whether an idea meets collective expectations. A criterion refers to something we value, like safety, cost efficiency, and equity. Having shared criteria is what allows decision-making to be a collaborative practice instead of people digging their heels in and arguing the virtues of their own preferences, which often happens, especially if you have a large group. Every idea can be assessed against what we've all agreed upon is important. In the example I gave, we have to consider whether tactics we choose meet our motivating vision, which is reducing overprescribing of prescription opioids, treating addiction, and saving lives. So always keeping that front and forward as we look at the tactics that we're going to be recommending or deciding upon. Number 4 is evaluating ideas using the criteria or narrowing, So from the ideas generated, we have to think about which ones have real promise, which are the group collectively really excited about, because if there's excitement, it's going to be the work will be more fun and more likely to get done. This step whittles down the large pool of ideas through a collaborative process of using the decision criteria together. The team tests and scores each idea against the established set of shared criteria to select those that best fit the criteria. So you have your own list of tactics and you go through and you decide which you have like a scoring system to decide which ones really are going to be the most effective. This helps the team avoid polarization, where one subgroup or passionate individual advocates for or against particular ideas for reasons not among your group's criteria. So somebody comes in just really excited, they join the group because they read in some research paper that, XYZ is really going to solve everything. But really, when you look at your criteria, it doesn't fit. It's a little bit easier to talk the person down or whatever. And then number 6 is learn from the decision. So this last step can be engaged in 3 ways. And one is through immediate reflections after you've made the decision about what worked and didn't work in your collective decision-making process. Number 2 is planning ahead to learn from our decisions as we take action, and finally learning from the choice we made. So that's always important, to always be talking within your team, thinking about, why did that work? Why didn't it work? Do we have to make a change? That kind of thing. So we're going to give some examples, if you want to go to the next slide, on establishing and using decision criteria. So this is just some example criteria that when you're looking at tactics and you have your list, you might want to think about, does it address whatever your root cause is? So remember, it's really important that before you start the work, you figure out what is the problem and why hasn't solutions worked in the past, what is the root cause, and is whatever tactic we're choosing, is it addressing that cause? Is it realistic and achievable? I mean, if you don't have enough money or enough people, enough resources, but you have some great idea that you're going to have some statewide campaign of maybe, TV spots or, but you can't really afford that, it's not going to be achievable. Is it difficult to do? That could get in the way. Cost, again, is it too expensive? And how much time is it going to take? Usually, sometimes you have a limited time. There's some urgency, and you want to make sure you have enough time to do whatever it is you choose. And then you create a scoring system. So before we go to the next slide, I'm just wondering if, as you hear about that, is there other things that you can think of that might be good criteria for determining whether or not a tactic is doable? Any other ideas? Okay, well, I'll be showing a couple of examples, and why don't we look at the next slide? So this is an example of a criteria scoring. So taking what we just talked about on the last slide about addressing the root cause, is it achievable? What's the difficulty rating? What's the cost and the time to complete? You see that this is how you might score it. You know, you might give a score of 1 if it's not addressing the root cause. If it kind of does, you might give a score of 3. If it definitely it's on point, then you would give a 5. And Carrie added impact. Is it high or low? Yes, that's a good one. And I think we're going to look at that on the next slide too, Carrie. I've got an example about with the impact. So this is just something you might want to think about using. Again, you can add whatever in that first column, whatever criteria you think are important, and you can come up with your own scoring method. This is just an idea, the 1, 3, and 5. And then that will help you come up with tactics that might be most reasonable to use. Despite the framework, however, your group might still enter into debate. Group members can disagree about how well particular ideas fit within the established criteria. So you might not agree on what score to give each one. And so to address this issue, you might try a couple of approaches. One, while you evaluate, don't lose the sight of creativity. As you go, continue to adjust ideas to help them meet more criteria. You know, change them along the way. You know, this doesn't quite fit, or this is going to be too expensive. How can we do it a little bit more creatively that it'll fit within what resources we have? If you find that a group is really attracted to a particular idea that doesn't score well against the criteria, you should ask, is there some hidden criteria here that's important that we missed? So if somebody's really passionate about something and thinks that it will really help, you know, reach your goal, but it really wasn't listed in the criteria, there might be some hidden criteria on the table that are used to assess every idea. So you might have to relook at your criteria. On the next slide, I have an example that we're using in the project, the opioid project that we're working on. And this is, and Carrie had mentioned this too, the impact, you know. So we're looking at like we're looking at whether a tactic or an idea has high impact and whether or not it's feasible. So what you could do is you could look at it within 4 quadrants. Quadrant A means it's an idea that's very feasible, something you can do, but it probably won't make much difference. So when you look at the root cause of whatever problem you have, it's not really addressing that. Quadrant B though says, wow, this is very feasible and it's going to have really high impact. So ideas that land in that quadrant are ideas that you're going to want to consider most highly. Ideas in quadrant C have low feasibility and low impact. They're really going to be way too hard to do and probably not worth it, because even if you do it, it's not really addressing the problem. So you could probably throw those out. And then D quadrant, they have low feasibility and high impact. So you think these are really, really great ideas, but right now I just don't know if we can do it. We just maybe don't have we either don't have the right people, our constituency, we don't have the right people with the right resources to work on this tactic, or we can't afford it or something like that. You might look at that in that quadrant and think, well, it's not feasible now, but maybe it would be feasible if we brought others on that had the resources that we need. So again, always looking at who your people are and trying to figure out, well, maybe we can get other people and then it would be more feasible. And so we just used this recently because we're trying to really come up with like who we're going to invite to our echoes. What are the subjects that we want to talk about? And so we had some great ideas from community leaders. And so we had so many good ideas, we had to start thinking about, okay, this is almost too much. We have to now we did a lot of figuring out what could we actually do, what's going to have the highest impact. And it's very, very effective. So I would recommend, it's kind of fun. So I would recommend that. Okay, the next slide. Okay, so we talked about learning from decisions. This was the 6th step in collective decision making. And so let's talk a little bit more about that. First of all, when you're learning from whatever decisions you make, think about how effectively did we engage in the process. So as you reflect on that, address questions such as, did we agree to the purpose of the process? Did we collectively understand the criteria? Were they adequate? Did we productively brainstorm, or were we critical of one another's suggestions? You know, people are gonna like, if you're not open-minded to like new ideas, people are gonna shut down if you're like, you know, that'll never work kind of thing. Did we evaluate alternatives in an honest but respectful way? Was it a close vote? And if so, how did that make us feel? And how can we enable ourselves collectively to accept the group's decision and move forward? So you need to think about that. And then also, before beginning to act on the decision, you need to plan ahead. What kind of feedback, information, and data can be evaluated as implementation begins? And alertness, learning from what happens, and being flexible and responsive are the cornerstones of really great strategizing. And finally, you need to learn from the results. So once implemented, there may be unpredicted consequences and other forms of feedback about whether it was a good decision. And feedback received is a learning opportunity and allows better, more informed decisions in the future. So, you know, you might have made your choices of what tactics you're gonna do, but it doesn't necessarily mean that those choices worked out. So you have to continually look and see, are we really, and that's why it's so important as you look at the different peaks we talked about, the different like thresholds that you're going to look at along the way. If you're not meeting those, if you're not getting close, you're not getting close to your intermediate like goals, then it's time to rethink. You know, maybe the tactic that we chose, you know, we thought it was really going to work out, but for X, Y, and Z reasons, it's not. So we have to rethink and change our course, and that's okay. And you just shouldn't be, well, that's what the score said, and we're going to be stubborn, and we said this is what we're going to do, so we're going to do it. Well, you know what? If it's not working, the quicker you can realize that and try a different tactic, that's okay. Otherwise, you're not going to reach that big aim that you have at the end. So I'm just wondering if, I don't know how far along you are or what kind of projects you're working on, but are there any of you that are doing anything right now that you have to consider what your options are that you're working on thinking about tactics? And if so, how are you going about that? And it sounds like maybe not.
Well, I was going to say, though, you could think about this too in the context of something you're already working on, maybe, where you either chose a tactic that ended up not working and this process might have been helpful. Or, I mean, as you think about facilitating this process for the coalitions that you're going to be building or working with on population health, what do you think might be challenging about this? So whether you go through and establish a set of criteria that you're going to score, or you use something like this, the 4 quadrants of feasibility and impact, and you think about trying to facilitate this conversation with a group, What additional questions do you have? What do you think might be hard about this?
I will give an example just again from, so what we ended up doing is we sent out that feasibility and impact quadrant to all these like thought leaders on opioids in our state that we had already had a conversation with to nail down some ideas. They're really super busy people. Okay. So it probably would have worked better if we did it like on a Zoom call or we had them right there, because we didn't get a lot of them back. So what we ended up having to do is saying, okay, these are great ideas. And maybe instead we should just say, okay, could you just send us your top 5 things, your top 5 tactics to see if we could get, and then we got a whole bunch more back. So it turned out that even though this was a really, really great, we thought it was a great idea and pretty easy to understand. When we send them a whole list of things and okay, start putting things into different quadrants, that I think that seemed a little overwhelming and like didn't really happen. We could have probably done that a better way. We still got some good, feedback, but not exactly how we, imagined it would go.
Thanks, Christy. Holly, I think you were going to say something.
Sure. I think one of the biggest challenges is if you have more than the 5 to 7 groups of people and you're not all on the same page about everything. I think that's where you get too many ideas going and, all of them are great ideas, but, you kind of got to just focus on that one thing that you're working on. So I think that's where I can see a challenge happening.
Yeah, and I think that's exactly what this process is meant for. So if you can if you can get these criteria on the table and really use them to objectively, I mean, the nice thing about this is if everybody agrees on those criteria and you can assign scores to each idea, it's not about any one particular agenda for a person or an organization. This is an objective way of really helping the group decide together what's going to work best. That's not to say it's not going to be hard. I mean, this will take some time to talk through this, kind of figure out where things go. And especially, I mean, Chrissy just talked about if they asked everybody on the coalition to submit 5 ideas, you could end up with 25 different tactics that you're considering. So then you have to decide, okay, can we work through that decision-making process as a group? Are there things we can do behind the scenes? Like if you already have the criteria, maybe there's a subgroup that can assign scores and present them to the group to review or put them in that grid for everybody to look at together.
Yeah, Kim, this is Carrie. I think to that point, I think that's why I really like the criteria scoring, with the table where there are multiple criteria that you are taking a look at, because I think that does actually get deeper into what's important to each of those individual stakeholders. And so I feel like it's just, I mean, obviously the quadrant one is easier. It's a little bit easier to use, but I feel like this table really gets in deep to what's important to the group versus, what might be more important to just a couple of people or a couple of stakeholders within the group.
I mean, I think the other thing that can make this more complicated is if you've got a coalition that includes organizations from different settings, for instance. So I think about, I don't know if any of you were involved in the RARE campaign. This was, wow, almost 10 years ago now. It was like 7 or 8 years ago. But it was a readmissions campaign that we did statewide with, I think there were 84 different hospitals involved. But a lot of that work was done with community coalitions that included hospitals and nursing homes and home health agencies. Well, the same tactics aren't necessarily going to work in all of those settings. So what will work in a nursing home isn't necessarily going to work in a hospital. So, part of what you have to navigate too is, does everybody need to do the same thing? Or do we need to figure out sort of what are the set of options that we can choose from that are relevant to these different settings? So in the RARE campaign, what we did was our focus was on reducing readmissions. We identified 5 key areas that were the most common contributors to readmissions. So it was things like medication safety and communicating at care transitions, discharge planning. And so then we said, the tactics we choose need to fit within one of those 5 categories. So it gave us more options to choose from, but we still had criteria for determining, which ones were actually going to be impactful and, had some evidence behind them to help each organization kind of pick what would work best in their particular environment. Other examples that you have experienced where this might have been helpful, or where you did it and it worked, or things that you think about as you plan for the work that you're going to be doing. Okay, well, so in terms of next steps, a few things to think about. So continue to work on that organizing sentence, that shared purpose that we talked about last time. So being, and think about doing it, I don't expect necessarily that you have everything figured out yet for this population health work that we're doing, but think about doing it for something that you're already engaged in. Again, this can be really helpful, even if you've already started the work, to go back and say, okay, can I really clearly and concisely describe what this group is doing or what we're planning to do? Practice that collective decision-making process. So again, you can try this out on a small scale. You can even do it on your own with things that you're planning in your own work. As you're thinking about, am I going to do this or this? Come up with some criteria and think about how you would score them, or use that matrix to look at feasibility and impact. But start to think about how you can use this objective decision-making process in different ways in the work that you're already doing. Later this week, we'll send out the pre-work for the final Learning and Action session. So June is our last session in this coalition building series, this leadership and organizing and action. And then where we'll go from there is the July session is really going to be about understanding the current state of things. So for each one of you, we're going to ask you to do some pre-work to just make sure that you have a good understanding of where you're starting from. So what's that problem that you're trying to address? What are the resources that you have available in your community? If you already have a coalition, kind of, how are they functioning? Where, maybe where there's some gaps. If you don't have a coalition yet, start to think about who you might want to have engaged, what resources they have available. But so we're going to give you some homework to do between that last session in June and the July session. And if you haven't completed that population health readiness assessment too, we would like to get that from all of you by, I think I said June 4th, the email. I'll reiterate that when I send out the email this week. So questions about any of that? Or Carrie, did I miss anything?
No questions from us.
Okay. Well, I'm sorry we had a smaller group than usual. We'll have to check in with folks and see what's going on, but hopefully we'll have the full group back next time. I want to thank Christy for sharing the content today and providing some good examples of how to use these tools. Any final questions, comments, updates? Okay, thanks everybody. Have a good holiday weekend.
Bye, everybody.
See you next time.
Thank you.